Alrighty, so we found with Koi's foot, he's got a hallux valgus. He's got a foot that starts in pronation, and he lacks the ability to further pronate that same foot. He's also got a calcaneus which lifts off early and doesn't evert well neither. He also has a very late internal rotation of his tibia, so he'll bring the knee, he'll bring that shin forward, and then towards the end he'll get that internal rotation at the very end. That's kind of like a lagged effect. Okay, so now what would you guys do to treat something like that, and we can actually test it out and see if it improves a little bit.
One thing we could work on for the internal rotation of the tibia is that exercise. That self-mobilization, so you're in a lunge position and then you rotate your tibia inwards, internally rotate, and you lunge forward to promote a smooth internal rotation throughout range.
Yep. You can definitely do that.
Yep.
So that he's getting internal rotation throughout the full range, so that his body can experience that, whereas usually it's staying fairly neutral and then it will internally rotate at the end. I would also assess his other foot. I'd assess his other leg to see if that's like just normal for him to start in that overly pronated position. If that's his norm, then and that's structural, then I mean there's not much we can really change there. We just got to teach him how to use what he has. So that'd be like a good thing. What else would you do? So that helps with the internal rotation of the tibia. It'll probably also help with his ability to pronate the foot. Yeah. What else would you get him doing? Like if our focus was just to make his foot movement as perfect as possible for him.
Another thing you could work on was the band under the first ray, and so getting them to supinate the foot, but then through range as well. So I think Koi was lacking a bit of supination, so if we got him to supinate and then come forward and back.
That's going to pronate him if he's got pressure onto the first ray.
Oh, okay.
Or you can put it behind the calcaneus with their band to keep it like against the ground.
You could, yeah. You could put a calcaneus on the outer heel to keep him and tell him to keep the pressure there while he does it, yeah.
Okay.
Because that's going to be more of a supinated foot. Yeah.
Okay, yep.
So that's something you can do, and you can get him doing like either a single leg deadlifts there, or even just doing that like more gait mobilization type of thing. Anything else you could think of? No? Yeah, nice. So one thing I would do with Koi, and we can actually, do you guys want to test that actually? Do you want to test it?
Yeah, sure.
Let's do it. Yeah, go ahead.
Alright, so the first one would be the internal rotation.
Yeah, go ahead. Do it.
Put it in the lunge position.
Do you want to do the other leg? I think that's the one we tested, isn't it? Was it left or right? Which one was the one we tested for you? Wasn't it your right leg?
Right leg.
Yeah.
Yeah.
So just get the right leg up. Yep. And you're actually keeping an internal rotation the whole way, so you're not letting go. The whole way through, yeah. Maybe we'll do 5 more reps. 1, 2, 3, 4, and 1 more. 5. Now can we reassess? So let's get you standing up, and without thinking, just bend the knee forwards and backwards. So what do you think about his internal rotation? It's more smooth this time? Doesn't look like there's a clunk at the end anymore.
Yeah, it's a little bit smoother. It starts earlier in the range, but then it pauses for a bit. So it starts earlier, but I think throughout range it sort of gets stuck.
So then let's try the other one. Do you guys want to use the TheraBand? Where is it now? It's behind
foot to promote
Yeah.
supination.
Yeah, the outer heel, yeah.
So you know, okay. So I'm gonna put this underneath your heel, Koi. I'm gonna distract it, and I want you to maintain pressure on it and don't let me pull the bed away. Okay. Yeah. Challenging. And so I'm starting to see the band slip, and so I know how much tension to put. Put more tension if it's too easy, and put less tension if it's starting to slip. So you can adjust the challenge point.
And you can also just get like, kind of do like a mini walk, so step through with the leg if you want.
Oh, slipping. Yep.
But you can see, yeah, it's working because he's got a shortened arch there. So if your goal was to get him to supinate, you got him doing it. Okay. Do you want to retest now? What is it? Yeah, I think that was helpful. His arch is coming up, and then he comes back down now. What do you think? Can you see a difference?
Slight increase in supination at the beginning of range. Yeah, slight. But I'd say it's quite minor.
Really? You'd say it's quite minor. I think that's a good change.
Well, probably for the foot, there's not a lot of like the
It's not going to move a lot.
Yeah, yeah.
Sweet. Nice.